SimHealth Innovations is collaborating with the Institute of Human Virology Nigeria on real-time documentation of health records of people living with HIV using an optimized electronic health record system. Electronic health record systems are designed to store data accurately and to capture the state of a patient across time.
My name is Dr. Adetola Olateju. I'm the founder and managing partner of SimHealth Innovations Incorporated. So SimHealth Group is a healthcare management consulting company dedicated to providing solutions around technology for healthcare institutions, both private, public, across all of the tiers, primary, secondary, and tertiary tiers. Our mandate is to leverage the expertise around technology for healthcare from the developed world, especially the United States, where I did most of my training, to the developing world, where a lot of these lessons can be easily adapted. So we have a passion for adapting innovation to truly make impact. A lot of the work that we do is going into a lot of these facilities and identifying problem areas that we can quickly address and challenge. Especially with technology, there's been so much phobia around uh, the use of these computers for healthcare delivery, and we have been able to identify how we can use a lot of this experience to get these computers to the end users, whether they're doctors, pharmacists, laboratory scientists. There's been so much innovation, but how can we as a country or as a continent or as developing nations be able to harness some of this innovation and use it for the true impact of the patient?
My name is Edima Otoro, and I'm the lead project manager at SimHealth. The real-time electronic health record system has been a turning point in the lives of the providers and the patients, and even the institute at large. So apart from this electronic health records project for the HIV care,
At least patient waiting time should not should be average, and clinical data should be available for clinicians to see the information of the patient they are looking at. It is great having open MRS and in real time.
My name is Oluwafemi Oloke. I'm the head of health informatics for the Institute of Human Virology Nigeria. IHN decided on implementing electronic health records to improve on our program as well as patient management, to reduce the tedium of the work associated with IHV care and management, to reduce turnaround time for both patient and service provider, improve on our lab services, add value to our program and the lives of our clients.
My name is Nancy Iwejilan. I'm a medical lab scientist. I'm the one in charge of viral load sample collection. Okay. The EHRO have actually helped us a lot. For instance, in the process of finding out if a patient is eligible or not. So once a patient comes in, we'll be able to log in the PEPFAR ID into the system. And with that, we'll be able to know whether the patient is eligible or not. So we don't have to call the doctor that requests for the test or to go and find out, okay, is the patient eligible or not. We'll just be able, we'll check the system and we'll see all the details. We'll be able to know the last time the patient came for the viral load, and we'll be able to also see the result. We'll know whether the result is suppressed or is it unsuppressed. So that if it's suppressed, we'll know that, okay, this one has to be on routine. That means patient have to come once in a year. But whereas if it's not suppressed, we'll know that, okay, as this patient, has it go for counseling, does she have good adherence now? So that we'll know, okay, after 3 months, we'll have to repeat sample collection. So that's what the EHR will be able to help us with.
I'm pharmacist Mariam Ahmed, the pharmacist at the pediatric unit. My experiences so far with the open MRS is that it has actually made our work a lot easier. It's better than the usual folders and all that we usually use.
Since in 2018, when they introduced EHR in this facility, I've been enjoying it and a lot of us is benefiting from it. But before then, I normally spend like 6 to 7 hours before leaving this clinic, and now we are enjoying it very well because of the EHR. Time wasting is no longer there. I can leave this clinic in less than 1 hour to go and do my business, and I'm very happy about that.